Hey guys, are you active in the chat? Can you see me? Yes, okay, that's great. So we're going to start this webinar. I'll go through, you're not going to be watching this for 3 hours straight. We're going to take a couple of breaks. We're going to talk about BMAT, MMIS, personal statement, and tactically applying as well. Ask any questions that you might have, because we literally came just out of the system, so it's like really fresh in our minds. And so if you want to ask literally anything, we're here to help you. This webinar is totally free, so if you have any questions, please ask, and we'll try and sort them out for you. In terms of who I am, for those watching the recording, my name is Neha Biju, and I'm a first year King's College London medical student. And we're just going to go through the itinerary. So we're going to cover personal statements for an hour-ish, and then take a bit of a break before moving on to MMIS and how's that important, and then moving on to BMAT and tactically applying as well. Because I've personally not had any experience with the BMAT, I've called Addy to help out with that. He scored more than 12 in his BMAT, so he's more than qualified to take any of your questions. Okay, so going on to personal statements. This typically takes around 2 days to do, or 3 days if you can like really bang it out. But overall, it's kind of easier than doing, say, for example, an R&R form, which some unis also request after you've applied there. So, for example, Manchester, Sunderland, and Kiel, they all request R&R forms, and they're very similar to personal statements as well. So covering the contents of a personal statement, they include extracurriculars and supercurriculars. So extracurriculars are your things sort of like sports, maybe taking part in charity events, also taking part in any team games, team activities, and also just helping out in the community. Supercurriculars include your volunteering, also your work experience. So for example, I did work experience at a hospital, and that really helped me gain a perspective on how life as a doctor was, and also made me observe like other professions as well, such as like nurses, healthcare assistants, physician associates, and so forth. And putting that in your personal statement, something that the Medical Schools Council outlined was that you need to be aware of other professions as well. So include that in your personal statement, just slightly refer to it, and it can make you sort of have that sort of wider view or range in your personal statement. Another thing that you need is your references for work experiences and volunteering. You typically need to get the employee's name. You can't see the last line of the slide, no problem. And you see it now? Yes, okay, that's great. No problem. So another thing is the references for work experiences. You need to have the employee's name, your name, and them signing, say, a document or so forth, just to say like you've done the work experience, you've had time with them, what you've learned from them as well. There are templates. I think Medic Mentor gives you a reference plate. A lot of companies also say, oh, sign up to our summer school, for example, and it costs like £3,000. Guys, you do not need to sign up to that £3,000 summer school because it is so expensive and it's not worth it. I know people who have gone through the summer school and got offers, and I know some people who have gone through the summer school and not got offers. So clearly it has no impact on whether you get an offer or not. And a lot of people have said that summer schools aren't really worth it. They're a bit of a waste of time as well. So not to put any shade, but this is my personal experience. Also, try and get volunteering in a sort of medical related field if you can. So for example, library is working with people who are elderly and also really young children, which you see in medicine quite a lot. Going to a dementia care home or a care home or residential home, working with the elderly there. Also going to charities, hospices, they're really, really good for your personal statement. In terms of whether unis actually look at personal statements, they do look at personal statements in the sense that if you come onto a borderline situation. So for example, Leicester, if you have matching UCAT and you're sort of on the waiting list after your interview, which really does happen, by the way, guys, they then look at your personal statement to sort of differentiate who to give that offer to. So it says here, does the volunteering have to be long-term? Guys, absolutely not. I did my care home work experience for 3 days over 3 weeks. So I did 1 day a week for 3 weeks. Literally 3 days isn't enough because you've had that exposure, you've had that experience. In terms of work experience as well, I literally did 3 days at a hospital. You don't need to do more than that. Whether a big volunteering experience, so for example, I volunteered 3 years at a church, that can benefit in the sense that if they ask a question about your commitment to medicine, you can sort of say, well, I've spent 3 years having and spent time in a charity or a hospice, and that sort of shows your dedication that no matter what happens, or if you get put off from a particular job, then you can definitely go and see that you have dedication and commitment to a career. So what happens if you didn't get a reference from your work experience? So this definitely happened to me. Definitely go back to the place that you got the work experience from. Just ask if they can provide a reference. For example, my GP placement, I forgot to get a reference for. I just entered the GP placement place and said, hi, I forgot to do a reference for this particular work experience. Can you write one down for me? And they absolutely did. They'll write their address, their company name, etc. And then they'll write what you did, so your role in the work experience or volunteering, and then they'll sign it for you as well. It's just to make sure that if apparently there are rumors that they sometimes do random checks, but I really don't think that's completely true. However, just have that just in case. Moving on to the books for your personal statement. Can you get an online reference? Absolutely, yes. Yeah, you can. In terms of books, so everybody knows the book This Is Going to Hurt, but obviously that's so overused, so don't use it. However, have that sort of like background knowledge about it in case like you might have the opportunity to talk about it. Do No Harm by Henry Marshall is absolutely great. Doing the other books by Atul Gawande, I don't know if you've heard of him. That's an absolutely great book, and it's called Being Mortal, and it talks about elderly people and coming to the end of your life. I know it's a really depressing topic, but it's also really up to date in the sense that it talks about the aging population problems in the NHS. And so that's why having those topical books that you can refer both in your personal statement and also in the interview is really going to be crucial. Trust me when I say you're going to be keep coming back to the personal statement when you come to interview time, just to see how to answer that why medicine question, to see what you've done as well. In terms of MOOCs or research, I'll talk a bit about the EPQ. Definitely do like 1 or 2 MOOCs. Don't spend too much time on a MOOC because obviously it's not the most important part of your application. EPQ is helpful, but I found that a lot of people didn't do EPQ and still did really well. The EPQ only lowers your grade for Hull, York and Sheffield. So write that down. EPQ only lowers your grade for Hull, York and Sheffield from 3 A's to AAB plus an A star or an A in the EPQ. So that's the only place where it's actually beneficial. Or you can write a published piece of research. So for example, on the Youth Medical Journal, I wrote a Youth Medical Journal WordPress document, so you can have a look at that if the link is available on the PowerPoint and you can click it, or I can put one in the chat later on. And mine talked about dementia and so forth. And I had a common theme to this personal statement, talking about the elderly population, talking about work experience and volunteering. I kept to a theme of like talking about aging population and how that's a crisis. So that's definitely one way that you can approach personal statements. Sports are going to be really helpful. Some people keep saying, one of the rumors that I heard was that the music grades give you extra UCAS points, whatever. That is completely not true. It does absolutely nothing. It's not going to change your application whatsoever, especially for medicine and dentistry. Something that really helped me in forming my personal statement was a CV, essentially a collection of all the achievements that you've done. So then you can refer back to it. And if you keep editing your personal statement, I know people who have gone through 50 edits, 50 guys, 50 edits of their personal statement before coming on to their final draft. I did about 6 final drafts. I got it checked by about 2 companies, I think. And then I also got it checked by a GP and then also by my biology teacher as well. So just have that checked. It's obviously not the most important part of your personal statement. It's very rarely that medical schools look at personal statements, but it's there. It's there to guide you and also refer back to you in your interview seasons as well. Does it matter that I don't have a grade for playing an instrument? I self-taught myself, so I'm not sure if I should mention it. Guys, it does not matter if you have a grade for an instrument or not. You can just say that I can play the piano, or it has helped my dexterity, whatever. And that's going to be helpful in your personal statement as well. So you absolutely don't need to have a grade per se to put it in your personal statement. Obviously, a grade makes it look more established, but it's absolutely not a necessity. So, star structure. So there is situation, task, action, results, and reflection. I'm pretty sure you've heard of this 100 times over by now. I'm not quite sure. So the situation, this is how you're going to structure your personal statement. You've got your introduction, you've got your conclusion, and you're going to have 3 star paragraphs in the middle. You're going to describe the situation you were in. Say, for example, you were in a hospital. I spent time shadowing nurses or doctors. I saw how they interact. If you can mute yourself, that would be great. If you have any questions, put it in the chat. See how you sort of shadowed doctors, see how you saw them interact with patients, build a doctor-patient report. Make sure you include really key words in your personal statements as well. That's going to be really useful as well later on in the interview sessions. Task, how did this make you feel? So did you feel out of your comfort zone? What did you think of it at the time? Did you feel nervous? Did you see how the doctor interacted with the patient? Did they build up their communication skills? Did they talk about how they showed empathy to the patient? Talk about compassion, all those really key terms that you see over and over again. Action. So did you personally help out this place? Did you play any key roles? So for example, in the GP placement, I did a urine test sample. So that's really great in saying that I actively took part in this particular task. Medical schools love that because a lot of medical schools try to do problem-based learning, and you're going to have to take that initiative in doing the research task, doing the sort of practice that comes along with that. So medical schools love that you have the initiative to take part in stuff. Results. So what was the outcome of your actions? Would you change anything if you had gone there again? So for example, when I was at the GP placement, I wish I took more opportunity in asking the GP about the way that they sort of balance their work-life balance, because that was a really key thing that came up in my interviews as well. Work-life balance is such a key part in wondering whether or not you're fit enough to go to medical school, because medical school is so draining. reflection, were you happy with the outcome? How does this activity relate back to medicine? So for example, if you play the team sport, does this reflect in your multidisciplinary team in medicine? Does this sort of help your collaboration skills, your communication skills? And those are really, really important things to reflect upon. And then you're going to put them in 3 paragraphs in your personal statement. One is going to be about volunteering, one is going to be about work experience, and one is going to be some sort of extracurricular like sport, instrument, etc. So, do you guys have any questions on the STAR structure, how to structure your personal statement? Okay, so we're going to move on to like the sort of overall structure. There is an introduction and the conclusion. You're going to leave these till the end because most of the time you refer back to the body of the personal statement when you create your personal statement. Don't be afraid about talking about, say, pity circumstances. I absolutely did talk about pity circumstances. We'll come on to that later as well. Talk about like how medicine is not just a science, so have that broad perspective that medical school people are looking for, that you need to recognize that there's empathy involved, that there's compassion involved, that there's communication and teamwork involved as well. It's not just the academic thing of biology, I love biology, so forth, so on, I want to help people. Obviously that's not going to get you anywhere. So talk about what inspired you to take up medicine. That can be cringy, I know it can be very cringy, but if it some people should be able to pick on it, talk to your peers on how your personal statement went. Obviously, at this stage, please be aware to not overshare. I know this sounds really mean, but when you're doing medical school sort of applications and stuff, if you keep sharing your resources and etc., you're really going to give other people an advantage. And medical school is getting into medical school is already as competitive as can be. So try and value those resources and talk to your friends who are perhaps not medical orientated. So for example, I asked advice of someone who was doing psychology per se and asked them their opinion on my personal statement. It can sort of like pull you back from that medicine world, and sometimes it's not even people who are related to medicine who are reading your personal statement, so be careful. Some people talk so much about little details that they learn, that perhaps a layman or a common person will not be able to understand. And that's really going to show that you have a lack of communication skills because you're not able to talk how other people are able to talk to. So if you're talking about the certain nerve in the brain, people are not going to be able to relate to that, and they're going to think you're not being able to like sort of explain it properly to patients later down in the line as well. 3 paragraphs using STAR: clinical setting, volunteering, leadership, and teamwork. So for my leadership and teamwork example, I will come back onto that later. I think I've attached my personal statement here, but we'll go on to that later as well. So in terms of key terms, you need to mention the 6 C's for the NHS, the 4 pillars of medicine. Does anybody know what the 4 pillars of medicine are? Put it in the chat if you know. Okay, so the 4 pillar of medical ethics is essentially autonomy, beneficence, non-maleficence, and justice. And those 4 pillars of medicine are really gonna form the basis of not only your personal statement, you're gonna refer to them again and again in your interviews as well. You need to be able to reference the continuity of care. So this would be, for example, a GP, for example, would see a patient right from the start of their diagnosis. They're the ones diagnosing the patient. They would then refer it onto a consultant, and this sort of chain of events, say if the consultant needs to refer to a surgeon, saying do they need an operation, that sort of shows that continuity of care that the NHS provides. And you're going to put that in your personal statement, drop it in your personal statement, and that's going to show the people at the medical school admissions team that you really know the key terms involved with this. So, cradle to coffin is a term frequently used by GPs as well, because they see you right from when you were born all the way up until you die. And so that's something that people also refer to when they talk about their GP placements. Empathy, you obviously know what that is by now. Empathy is being able to put yourself in other people's shoe, and that's really key to being a doctor, and you need to be aware of that as well. Holistic care. So, for example, this might be if there was an obese patient that came in, it's not only the obesity that you need to treat, but it might also be the underlying issues behind that obesity. For example, the depression or the anxiety that causes them to overeat. And so that might also contribute to holistic care. And it's not just about the science in medicine, it's also about the empathy and the sympathy and the compassion that comes along with it. You also need to be aware, and you also need to reference that you know how overburdened and underfunded the NHS actually is. You need to be aware that there are loads of problems within the NHS, and that junior doctors don't perhaps have the best working conditions either. So you can refer that in your personal statement, and then you will be able to show the medical school admissions team that you have a realistic overall view of medicine. Multidisciplinary team. So this is talking about how nurses, doctors, consultants, they all work together to give the patient a sort of overall view on their diagnosis, their treatment. They work together in order to produce a prognosis and their treatment plans as well. So even the patient is included in a multidisciplinary team. So we'll come on to an example later in my particular personal statement, and it talks about how teamwork allowed a particular patient to be diagnosed properly and have their treatment plan sorted. Patient-centered care. So this is really centered around autonomy, coming back to the 4 pillars of medicine. And patient-centered care is where you look out for the patient's best interests. You're not looking out for what the doctor thinks is the best idea, not what the nurses think is the best idea, but really concentrating on the patient, not disregarding their opinions. So, for example, if the best course of action is to have a particular antibiotic, but the patient doesn't want to have a particular antibiotic, then you have to respect that decision and focus on patient-centered care. So this is a part of my personal statement that I wrote. This is the first half of it. I'm just going to talk you through it. You can have a read on the screen whilst you're there. So I start off by talking about a sort of pity story, and that allows the sort of medical school admissions team to be drawn into my personal statement, because those first few sentences are really going to see what catches the audience's sort of attention as well. And so you need to make that as catchy as possible, and make sure that you are aware of the NHS's sort of key values and core principles that to include in your sort of first paragraph there. Then I talk about volunteering. So I volunteered at Inglewood Dementia Care Home, and I talk about my experience. I talk about my feelings. I talk about dignity, which is a really key idea that comes across in interviews as well, and patient-centered approach again. So put all those keywords in, and it sort of makes you think, well, she knows what she's talking about, or he knows what he's talking about. And so putting that in a really nice, neat paragraph is going to get your personal statement standing out from everyone else's. I've also like slid in MOOCs and also like research articles that I've done here. Ideally, you need to reflect, but obviously you don't have that much space in a personal statement. You need to cut down as many words as possible. So yes, you will end up bunching stuff together, but try to make it as smooth as possible. Even coming onto my first draft of the personal statement, it was kind of chunky and the paragraphs didn't really link to each other. And so that's a really key idea, that you need to make it flow. It's exactly like an English essay, essentially, which I know we all took sciences because we kind of hate English, but you need to come back onto that writing skill, which is going to be helpful in later in the future when you publish articles as well. So really spend time doing your personal statement. It took me about 3 days to do my first draft, but obviously it was over the limit. There was no words cut down, and then I talked to my teachers about it, talked to health professionals about it, and then slowly cut down my words and saw what was relevant to my personal statement. Don't keep irrelevant stuff in your personal statement because they're not going to look at it. If the overall population thinks that a particular idea shouldn't be included in it, then just go with the flow, because the medical school admissions team are reading thousands of these personal statements, and so they're really looking at the common point of view. This is the second half of my personal statement. So it doesn't matter how long you volunteer for and where you volunteered. I volunteered for 4 weeks in the holidays at a charity shop, but not sure if that's enough. So that 4 weeks in the holidays at a charity shop is more than enough. So it doesn't matter, as I previously mentioned, how long you volunteer for, I would say. But if you do have an example where you did spend a long time, it can really help in the interview stage when you talk about commitment to medicine, because it means that you can turn up on the day regardless of how the situation is, and it can show your dedication and commitment to the career. I volunteered for 4 weeks in the holidays, and where you volunteer. It does slightly matter where you volunteer. You can't volunteer at a bar, for example, or something like that, because that's not gonna be relevant to medicine per se. But, if you yeah, exactly. So if you volunteered at pharmacy or, a care home or something like that, then or a charity shop even, then that's going to be really helpful. That's definitely relevant to med school, or even a library is relevant as well in terms of volunteering. What can I talk about in my personal statement for medicine? And should I still talk about it if I volunteer at a hospital as well? Okay, so in my opinion, if your work experience is at a hospital, or if your work experience is at a hospital, then definitely talk about your hospital work experience, and then don't talk about your volunteering at hospital, because that sort of doesn't show much of a variety in your personal statement. But I would talk about your volunteering in pharmacy. But if you don't have hospital work experience, and you're talking about your GP placement, for example, then you can definitely talk about your volunteering at a hospital. Hopefully that made sense. So don't talk about two situations where you've been in a hospital, but I would switch and make a variety, I guess. So coming on to the second half of the personal statement, this is talking about my GP placement. There was a particular scenario where a patient was really depressed and didn't want to turn to a psychiatrist because they felt as though their son had been failed by a psychiatrist. And so this was a really emotionally complex particular case. Definitely don't copy this example here or any of the examples given, because you would be done for plagiarism. I think they scanned them for plagiarism, so please use your own unique work. Later on, I talk about my hospital work experience. I was in the ob-gyn ward. Definitely interact with the doctors and the patients more than you think, because you really need to show your communication skills, and then later on when you do your interview, it's going to flow more naturally if you have more stuff to talk about. A lot of the times people think, oh, I can just rehearse my interview, I can just by heart a paragraph. Trust me when I say you're not going to by heart 90 paragraphs on 90 different questions. You're going to have to talk fluently, and you're just going to have to sort of think on the spot. Obviously, for questions like why medicine, you're obviously going to have a rehearsed answer, but definitely have that sort of flow in your head and have really vivid memories. Maybe write down your journal thoughts so that you can remember these sort of experiences very clearly in your head. And then we come on to the conclusion, and it's sort of a little bit of waffle. I can't lie, it's not the best conclusion in the world, but typically speaking, medicine applications team don't really read the end of your personal statement, which is why always put your best examples at the top, because that's going to be really helpful for you. So we do have a £2.50 personal statement ebook. Hopefully, this mini topic on personal statement has been helpful. Do you guys have any questions on personal statement? How to apply on UCAT as well? Because I know that was a problem for me. Would it matter if one of my work experiences was a hospital in Asia? Absolutely not. If it's a work experience in hospital abroad, that's even better, because it means that you have a wider perspective on healthcare. You know that you're aware of both the NHS and other places in the world, and you can compare healthcare systems as well. So absolutely not. In fact, you can possibly talk even more if you have an abroad hospital work experience. We're going to take a break here. I'm going to keep answering questions as they come through. I know this is a long shot, but do you know what happened to do? Do you happen to do personal statement reviews? Yes, I do. For £20, both by me and a NHS doctor as well. So we'll come on to that at the end. I think I'm going to do that later. As I did some works at hospitals, is it okay to talk about volunteering in like a local community outreach branch at a church? The community is mainly made out of elderly people who go into experience and life of care. So I think you should talk about both ideally. You should do a paragraph about hospital works, and then it's also incredibly important to talk about your volunteering at church as well. And elderly people, I that's actually the ideal situation. Talking about their experience of end of life's care, and you can talk about aging population as well, because that's a really key idea, and it notices that you have an idea of the NHS struggles and what they're coping with. I really recommend, if you're going down that route, to read Being Mortal by Atul Gawande. You can nicely slot that in your personal statement. How would I mention the struggle of junior doctors in my personal statement? So I'm pretty sure a lot of you are aware that there was a lot of junior doctor strikes both in 2023 and in 2016. If you want to talk about junior doctors, obviously that's a harder topic. If you can find a book on junior doctors and their struggles, that's a really easy way of sort of slotting that into your personal statement. You can also talk about how I was aware that the ward was understaffed, for example, and then you could possibly say there's understaffing, which puts pressure on junior doctors to perform really well. We're going to have a break until sort of 9:45, hopefully. So yeah, talk about junior doctors in that way. You can also say that you're aware or you've read news articles on junior doctors, and sort of slot it in that way as well. I've just had a question on, is it good to research what topic is too good to research a topic? Would you recommend to do so? And if so, what kind of research? So I did my EPQ on the bar with Garber case. It can be absolutely on anything, but definitely try to keep it towards medicine, if you can. One of the research topics that I was going to do was on paracetamol and whether if it's actually effective or not. That is definitely a debate that you can possibly do. I'm throwing that idea out there for you guys. It is definitely good to research a topic. Definitely either publish it or do an EPQ on it. I wouldn't recommend doing both because both of them are really respectable as well. Definitely, I do recommend it, but I would say try to keep it as short as possible. Unless you're applying to Sheffield or Hull York, doing an EPQ isn't really recommended. But publishing a sort of small article really is. I would highly recommend it. And then also, if they ask you like what particular interests you in medicine, then that's an amazing opportunity to show off your research skills and to talk about it and talk about your experiences of researching. In research articles, you have to look at sources, you have to be able to cite sources, you have to be able to look at statistics, see if it's a good, reliable source. So, for example, is it from Daily Mail, which isn't really reliable? Is it from TikTok, which isn't really reliable either? Or is it from BMJ, or is it from the Lancet or something like that? And that's going to be really helpful to talk about in your interviews, and you can slot it into your personal statement as well. I realized I didn't answer the second half of the question. If so, what kind of research? Definitely medical research. In terms of medical research, I would say sort of you can go for medicines, but in a sense, medical schools don't really like that because when you talk about medicines, you're going to be learning about medicines at medical school anyway. So if you go for like a sort of largely controversial topic, that not many people have covered. So, for example, if music therapy is effective for dementia, if paracetamol is really good for you, is certain drugs actually effective for you? Is physiotherapy really helpful? Those sort of controversial topics that can be debated, or like, is euthanasia really ethical, or should abortion be legal? So forth, and those sort of research topics. I would say those really controversial ones. So another question that I just got sent through is, if I wanted to publish something, what should I publish it on? Would it still count if I published it on my school's medical society newsletter? So I would say try and publish it on a public platform. Obviously, publishing it on your school's medical society newsletter is great as well. But definitely I recommend Youth Medical Journal. I know some people have, if you have connections, obviously that is, you can definitely publish it on the BMJ if you can. I really doubt you can, but if you can, that would be great. So Youth Medical Journal is always open to publishings. I know Medic Mentor have that sort of like publish on like a huge newsletter as well. That's really great as well. And also sort of um try and make it so that many people see it and not just a small society, if that makes sense. I don't know how big your society is, so how long should the research be? So if you're publishing, obviously, if you've got an EPQ, you've got set research to do. But if you've got a sort of youth medical journal article or something like that, then probably about 2 pages maximum. Like you don't need to put that much effort in. You just need to sort of outline the main cause of the argument, to and fro, and then a conclusion. You can obviously view my article later, and you can see how short it is. It really is very short. And it's just to have that sort of namesake of, hey, I did some research and I published it. Because when you publish a piece of research, it has to be checked by very many sources as well. So if you publish on the BMJ, it's going to be checked by many, many doctors. If you publish on Youth Medical Journal, it's going to be checked by many medical students and doctors. So having that sort of check is really what differentiates it. And very short research is enough to put it on your personal statement. Okay, so for those who actually took a break, you can definitely, hopefully, you've had a nice break, had some cup of coffee or tea or your breakfast even, and we're going to come on to the MMI interview side. This is definitely possibly the hardest. I know you guys have just done the UCAT and you've probably either got a really good score or you're really thinking, wow, I've got this down. And honestly, I had the same mindset that you guys had. Well, if I've done okay in UCAT, I should be okay at interviews as well. I know that might seem like a stupid way to look at things, but honestly, that was the mindset that I had. I thought I could waffle my way through interviews and be okay, but that's absolutely not the case. You really, really need to practice. Don't underestimate it. A lot of sources tell you that, sorry, I'll move on to the next slide. A lot of sources tell you that you need to be able to, you can sort of like wishy-washy and like talk about waffle and get into med school. And maybe pre-COVID, this might have been the case because a lot of gap year students came through when COVID came around and there was a lot of confusion going on then, and it's caused a big backlog of gap year students. If you're a gap year student watching this, That's absolutely okay, but I'm talking in this sort of perspective as a leaver. I was honestly surprised by the number of gap year students who were part of the interview process. Honestly, one of my friends went to an interview in Southampton, and I'm not sure if you guys are aware of this, but Southampton has a group interview, which no other medical school has. And she realized that all of them were gap year students. So if you're choosing to take a gap year, that's you're definitely not by yourself. And if you're a school leaver, just be aware of that, because as a school leaver, you sort of have less time going into interviews because you've probably got mocks going on, you've probably got personal statements going on, you've probably got a BMAT thing going on as well, and so it can really be rushed for time. In my experience, when I was doing the interviews, it was in December. If you have a higher UCAT, you're more likely to get your interview earlier, by the way, so that's a big tip. Obviously, some schools it's random, but for me, that was the case. I had 3 of my interviews before December, so it was a really, really rushy time for me, which is one of the reasons why I didn't choose to do the BMAT, because I was prepping for interviews. And also be aware that, where did you get your interviews from? So I got my interviews from all 4 of my medical schools. I got my King's College London medical interview, Sheffield, Leicester, and Aston. So talking about all 4 of these and how I got them actually. King's College London, it was kind of last minute. They gave it a week before your interview or 2 weeks before your interview, and it uploaded on this platform called King's Apply. So it takes a bit of a while. So that's why when they give you like a 1 week notice or a 2 week notice, it's really like last minute, and you need to be prepared for that, and you need to start interview prep early. Sheffield, I got my they have a set date in which they give interview offers, and then you're allowed to choose your date when you get your interview as well. And I chose my Sheffield interview to be in January because I had 3 interviews before December. When talking about Leicester as well, Leicester was also 2 week notice, and it was very last minute, and so was Aston as well. They all came through via email. I think Aston was the first one to respond to me, and then all the rest came later. It was kind of a busy period. I had my mocks during that season. I had to absolutely put all my effort into interviews because I had no time to practice for mocks as well. Honestly, it felt really draining, but please know that you're not the only one in this situation. There are other people also doing this sort of mock interviews, BMAT, and everything else. Sorry, can someone mute themselves? Also, when should we start interview prep? Honestly, as soon as possible. If you've got BMAT, obviously after that. I think that the BMAT is like typically in October now, and you can do that straight after your BMAT. Honestly, you need to grind. If you don't have it after BMAT, then you can start around after your UCAT. Slowly get a sort of sense of things, attending this webinar, for example, to just gain that idea. A lot of companies do free webinars. When was my earliest interview? My earliest interview was Aston interview was my first interview, and I think that was around the end of November was my earliest interview. And then I remember that my Kings and Leicester interview was on the same day, guys. Sometimes that can happen. I had my Kings interview in the afternoon at 4:20 p.m. and then I'm going to upload the recording onto YouTube, by the way. And I also had my Leicester interview at 11 a.m. So that can definitely happen. You can get 2 interviews at once on the same day. Honestly, that was such a draining day for me. I somehow managed to get rejected from Leicester and then got an offer for Kings, even though I did them on the same day. So it really depends. I also got an offer from Sheffield and Aston as well. Was your interview online? Yes, my interviews were all online. I'll come on to speaking about each individual ones first. I'll first do a MMI checklist that you guys need to do. So you, sorry. So you guys need to be aware of doing this checklist. You need to know every med school's information and know that like what their course structure is, what their lectures are like, what their unique features are, and you need to know everything to do with that. You need to use the medic portal and also get a subscription for Medfully. Medfully is honestly a lifesaver. I'm not sponsored by them or anything, by the way. But they were really underrated in my opinion. And they provide literally your flashcards for you. They provide all your notes really concisely and they're really up to date as well. So definitely get a subscription for Medfully and then use the medical portal because obviously that's free. Do lots and lots and lots of mock MMIs from multiple companies. Now, if your school was anything like mine, I came from a state school rated good by Ofsted. We didn't have many mock MMIs, and I think we only had one, and it had like about 3 teachers going round. And it was absolutely stupid because they weren't even biology teachers either. So definitely either work with people from other schools or work with peers from other schools, which I also did via like Discord channels. If you can try and find them, you really need to be proactive in finding these resources. Then you also can also do mock interviews from companies as well. I would say go for a variety of companies because different companies have different ways of interviewing them, just like medical schools. I chose the cheapest ones when I was doing my medical school interviews. So I chose Medica. And then when I came to the end, I think 2 weeks before my Aston interview, I chose the MSAG. I know it's really, really expensive. But in my head, I was like, well, this is a investment for my future. So some medical schools, so for example, St. George's, etc., will do free ones that are posted on Eventbrite. So you really need to search them up and go MMI, mock interviews, so on, maybe like every week or so, and check if they have free interviews going on at their medical school. So how do we go about the UCAS 5th subject choice? How you approached? Okay, so I actually made a really stupid error when I was choosing my 5th choice, and I put biomedicine at Birmingham because I'm from Birmingham, and I thought, well, what else can I put? I would just put biomedicine. But honestly, I know people who have gone for engineering and got an offer for engineering at like Notts and stuff like that. You can definitely put Oxford or Cambridge as your 5th choice if you want to. You definitely don't need to go about putting biomedicine. Don't put a uni that like you sort of go, well, oh well, like really think about like how like if you didn't manage to get into medicine, you would consider it. Like for example, I know people who have got into economics as their 5th choice. I know that you put down medicine personal statement, but a lot of unis, once they know that you're applying to medicine, they really value you and they'll still give you an offer for like say economics or something like that. Obviously you can also submit a different personal statement to them, like you can email them and say this is my personal statement for economics, for example, and go about it that way as well. So essentially don't make the same mistake I did and put Birmingham biomedicine as your 5th choice, because I was never going to go to biomedicine at Birmingham, even if I got rejected by all 4 of my unis. So I've put all the prices down here for you, and on the next slide, I've also got the prices for the rest of them. Don't go for the summer school. I know I'm saying this 100 times over, but honestly, they're so convincing, and a lot of my friends spent so much money on a summer school to not even get into med school. So please be aware of that. Please be aware of like these companies that are a bit too expensive and are sort of like scamming you in a sense. So In terms of mock interviews, these are the prices for mock interviews essentially. And we also do mock interviews as well for £20 with detailed feedback. And hopefully that will help you guys sort of reflect on them. We know that you're not only going to choose us, like you're not only going to stick with one company when you do your mock interviews. A lot of people chose the 6 med package. They did it for like £200. I know it's really expensive, but it was 8 mock interviews, and you did it for £200, which I guess was worth it. But if you do it for the same company, you're sort of learning a particular interview style, and that's not the case in your actual interviews. Okay, so here I've outlined a couple of different things. So, here is the medical portal website, which is the free medicine interview questions. They also have a lot of research facilities, like they talk about the Bauer-Garber case, the Alfie Guard case. These are really key things that you need to know, but they might not come up in your interview. Like, it's really like they deem it as general knowledge per se, but actually it's not. Medfully, here is the website for Medfully as well. And this little picture on the end is just to show that you can work with your friends as well. In terms of the ISC medical book, so guys, have you looked at the day on the medical school interview book? It says 2013. I don't know like how relevant it is to this day and age. A lot of cases aren't on it. The questions are good. They're all right. The answers are not gonna make you stand out at interview, because everyone's got this answer booklet, and honestly, if I said that answer at interview, you wouldn't stand out. You probably might scrape an offer, but honestly, I don't think the ISC medical book was worth it, and so I would stick to Medfully and Medic Portal. And if you have, like, say, a copy at your library or something like that, we also do a little interview book as well, which includes questions from this ISC medical book, but better answers, because the answers in this particular medical school book is literally like, I love biology, that's why I chose medicine. That's never going to get you into medical school these days because it's hyper competitive now. This is not to scare you, by the way. I'm just trying to give you really realistic advice. So I'm going to talk about my experiences at the MMIS interviews. Are there any questions so far? No. Okay, so King's College London. Panel interview with 2 interviewers. One was a doctor, one was a psychiatrist, and the other one was a layman, or she was an office lady. She had nothing to do with medicine. Questions are very open-ended, and you had 6 minutes to just talk away. Like, you just kept talking for 6 minutes straight. And this was supposed to be a panel interview, but it felt like an MMI. So I would say practice MMIs, because essentially that's what you're doing. I know Exeter, I think, does a panel interview as well, and my friend said it was very much like an MMI. You literally spent it just with the same interviewer, essentially. Sheffield gives you the questions beforehand, but they grill you very hard. So don't, like, expect that you're just going to go in with a by-hearted answer, for example, because you're not, because they grill you so hard. When I said, when I was answering the question why Sheffield, I mentioned cadaveric dissections, and then he went, oh, so you think cadaveric dissections are so good? Why don't other medical schools do it too? And then I was stumped. I was like, maybe they don't have enough resources. I don't know. So be aware that Sheffield, even though they give you the questions beforehand, they really grill you very hard, and they have a variety of people who speak there. They have surgeons, medical students, doctors, head of first year, head of second year, and also the medical students over there, they sort of like, you just speak for 3 minutes straight, but the doctors really grill you. In terms of Leicester, Leicester has a variety of MMI stations. They have audio, they have articles. They might give you a patient audio saying, I have a backache, and something like about their backache situation. And then they might be like, I can't bend over to pick up stuff that has fell on the floor or something like that. And you have to see how the consultation went and whether the doctor was showing empathy, compassion, and their communication skills as well. Also the article station that they have, I'm pretty sure you've seen this on TikTok if you've researched MMIs yet. The article station on Leicester, they give you practically a huge page of writing, literally a whole BMJ article, and you just have to like sort of summarize it and so forth, and like they might grill you on it a little bit. And that's essentially the Leicester interview. Honestly speaking, Leicester was possibly the weirdest interview I had out of all four. And they give you about 2 to 3 minutes to speak, and they also give you a question in advance as well, just to talk on for about 5 minutes, I think it was. You also need to be aware that Leicester has a high diabetic sort of population, type 2 diabetes population. So that's always going to come up, and always refer back to it. Like there are questions that subtly hint at it, and you have to bring it up because it's not on their marks. Like it's on their mark scheme and they're just ticking off the answers. And so you really need to be aware of the particular county that you're in and whether if it's useful, and those sort of like small sort of niche information that a particular county might have. So for example, Sheffield, for example, they have the Peak District. More people walk outside. They have a huge student population, so they don't encounter elderly people as much. Aston gives you many short questions. In one station, it was 5 questions. Each station was 5 minutes long, and it was like 5 questions, but one question you had about 1 minute to speak. And I felt like I was rapping when I was like doing the Aston MMI questions. So just don't. I'm telling you this so that you don't get thrown off on the day, because I definitely got thrown off on the day. Different, even though they all say MMI, literally Sheffield, Leicester, and Aston all say MMI, but the way they conduct it is all different. So definitely do research on the topic, talk to older medical students as well, and see how they've gone through the process and how their interview went. I know I can only talk about these 4 interviews. Hopefully Adi can talk a little bit about his interviews after doing the BMAT as well. So yeah, I'm going to move on to the next thing. MMI's medical school, I forgot to talk about whether these were online or not. So King's College London online, Sheffield was in person. You go in on the day and you sort of wait in a little lobby and you're speaking to other people. At first it was really quiet, and I'm really talkative, so I spent some time talking to somebody, and she was thankfully very talkative too. And she sort of eased my nerves, I guess, in terms of speaking to strangers. And then Leicester and Aston are also online, which is why I say, guys, when you take advice from like people who have done the interview process like pre-COVID times, it's not really helpful, because doing interview online is like very much like you're in a particular box with them. Whereas when I was doing my Sheffield interview, it was very much like I went around going and talking to other people, and I could hear other people speak, and it really threw me off as well. In terms of like, there's a lot of noise and background noise going on. And it's actually, I honestly hate in-person interviews because there's so much noise, and sometimes you can't concentrate on what you're about to say. In terms of MMIs for med school, you need to research their individual uni course. As I said earlier, you need to know how they teach anatomy, whether they do cadaveric dissection, how they do it. Is it a whole body cadaveric dissection? I know Plymouth uses holographs, I think. So have a look at that. The way they assess their students, a new thing is coming into place, which is called the medicine licensing assessment, which is, if you guys have heard of the USMLE, it's basically the MLE but for English students. And then also any interesting or unique features that set the uni apart. So King's had the Gordon Museum, which is where they store live specimens of human species that you can go visit once you're a medical student. It can really help you visualize the body, and it's really great to include it in your interview. If they do happen to ask why do you want King's, Leicester also pioneered in giving iPads to students. So they were the first medical students to sort of digitalize their learning. And they're really proud of that. So be aware of like the stuff that their med school is really proud of. I don't know if you knew this, but David Attenborough also grew up on Leicester Uni's campus. So that's definitely something you can talk about as well. Work-life balance, this came up in pretty much every interview. So in terms of work-life balance, Sheffield has a Peak District, King's has a guys bar. Obviously you might not want to talk too much about the guys bar, but you might want to talk about, like, say London and it's like good sort of work-life balance and the opportunities that you have in London, etc., etc. The fact that they have a market there as well. I know I'm talking a lot about Kings, but I'm going there, so that's why. Do you guys have any questions on sort of the general structure on MMIs? Please ask in the chat. Going on to the next thing. MMI's basic background knowledge. So why medicine? You need to know that question off by heart practically. This is basically your personal statement essentially. There are different types of course structure. Oh, I've got a question. Do you know roughly what they mark you on? They mark you on a different medical schools mark you differently. So for example, Leicester was literally a tick sheet. So they might mark you on the points that came across, because one of my friends, she didn't answer a question whatsoever and she was like, I don't know. And then the tutor gave the answer straight away, and they said that it was the specific points, I guess. So like you need to know, like Leicester has type 2 diabetes, for example. It's not like communication skills or whatever. Whereas King's, they score heavily on your communication skills. I think like 80 marks worth of communication skills. So it's a lot. And then the other half is the actual content. And then Sheffield was also like points based and a little bit of communication skills because I peeked over their iPad. And then also, the last one was Aston. I think they were really on about hitting the content points. We have another question. Can you use the same answer in your PS and your interview? Absolutely, yes, because the interviewers are never going to see your personal statement unless you go to Queen Mary's University of London interview, I think, and then also Cambridge and Oxford and Imperial, I've heard. That they look at your personal statement and they grill you on it. Unless they look at your personal statement in that sense, then yes, absolutely, you can use why medicine in your both personal statement and your interview as well. Types of course structure, i.e. Whether if it's PBL or traditional based lecture learning. One of the reasons why I didn't want to go to Cambridge was because of the traditional lecture based learning. I thought it would be boring for me, but King's has a bit of a mix in terms of lecture based learning and also PBL, so that's why I applied there. How the NHS was founded and history, so Anya and Bevan, etc., who founded it, everything to do with how the NHS is structured, etc. The how GPs act like gatekeepers. So you need to know the journey of a patient, essentially, how they get diagnosed at the GP first, and then they get referred to a consultant, and then they might get referred to a surgeon, and then they have the surgery, and then there's post-operative checks, and then you might see multiple nurses, for example. You need to know that for a lot of the sort of subsections in the hospital as well. We've got another question. Does getting a band 2 in SJT disadvantage you too much if you have a score above 3,000 in the UCAT? Getting a band 2 in SJT. So I had a band 2 in SJT with 3,110 UCAT score. I'll come on to tactically applying later, but band 2 in SJT means that you can't apply to Nottingham, but getting above 3,000 means that you can practically apply it anywhere else. So as long as your GCSEs are good, then you can practically apply anywhere, as long as it's not Nottingham, because for some reason, Nottingham places a huge weightage on the band 1 in SJT. So if you have a band 1 in SJT but an average UCAT score, definitely apply to NOTS. So types of how the structure of the NHS, so yeah, patient journey, etc., like that. Definitions of abbreviations: CQC, so GMC, BMA, MDU, so Medical Defence Union, the British Medical Association, etc., etc., because these terms are going to come up in very like sort of subtly, in a sense, like they might refer to it, but it's their everyday language. But for us, obviously, it's not our everyday language. We don't go around talking about the BMA and GMC every day, but for doctors they do, and so they might just accidentally say it in a sentence without you knowing. If you do get stuck on a particular word that they say, or like you don't understand like what they mean by a PA, for example, which means physician associate, then you can definitely stop and ask them. They really appreciate you like sort of making sure that you understand, because essentially at medical school, when you start medical school, you're not going to know everything. You're going to have to ask loads of questions, and so them seeing you engage and learning stuff is also going to be really crucial for them. Okay, so other NHS background knowledge includes, this is basically the whole list, by the way, guys. So I'm going to give you literally everything that you need to know. Disadvantages and advantages of private and free healthcare. So this is really topical at the moment, especially because junior doctor strikes are happening. They're wondering whether to privatize the NHS. I think 30% of GPs have private healthcare, which is a fact. And also, whether the NHS will be sustainable in the long term is also a key idea that you need to be able to debate in case they do ask you. A lot of these topics they might not cover in the interview, but you need to know them just in case. Disadvantages and advantages of being a GP, a consultant, and a surgeon. So they might ask you, like, what do you aspire to be within the medical profession? You might be like, oh, I want to be a cardiologist. Okay, so why do you think why do you want to be a cardiologist, not a GP, for example, etc., etc.? You might want to rope in a lot of work experience and volunteering, because they never directly ask you, well, in my experience anyway, they never directly ask you like, what is your volunteering experience, for example. They might be like, so what is your communication skills like? What would you rate your communication skills? And then you would say, well, I volunteered at a library and that really helped my communication skills, so maybe I would rate it a 7. I had difficulties then, but then I overcame it. They love that, by the way, challenges and overcoming that. That is absolutely golden when you come to your interviews. Will the recording be available? Yes, guys, it's going to be on YouTube by next week, hopefully. But it's going to take a long time to upload a 3-hour YouTube video, so hopefully if I can do that. 4 pillars of medical ethics: autonomy, beneficence, non-maleficence, and justice. need to be thorough inside out. If they ask you, you need to know. You need to know the GMC principles as well, back to front. I think there's 7 GMC principles, and you need to by heart them. Otherwise, if you get stuck, they're going to catch you out. And lots of medical students, like, they're very hungry for their medical school offer, obviously, so they're going to know it literally like this. I was so intimidated at the Sheffield interview because when I had my break station, I could hear other people speak, and oh my gosh, the thorough knowledge that everybody has is immaculate. It's literally unbelievable. So don't think this is a waffly experience for you guys. Somehow I scraped through everything, but and obviously I did practice a lot, by the way, and I still think I didn't prepare enough. So be aware of that. Confidentiality, consent, competence, and capacity. I don't know if you guys have heard of this. Gillett Competence, Mental Capacity Acts. You need to know them as well. This is a comprehensive guide. They might not always ask you this directly. They might not ask you what is confidentiality. They might, but you need to know this in sense of like SJT scenarios, in a sense, like if a doctor stumbles in rolling with alcohol in his hand is a very typical scenario that you will encounter again and again in your mock interviews and your actual interviews as well. Disadvantages and advantages of euthanasia, abortion. Pretty sure you guys had those RS lessons coming in handy. You need to know, but this time you need to know abortion acts, like when they were created, etc., etc. I know some people might have managed to sort of roll into a mock interview without preparing much, but they might also have a medical background. So like they might have people who are doctors in their family, etc., and they might know this information already, whereas a lot of people don't know this information already. So you need to learn from scratch. Vaccinations, what they are. COVID-19, guys, that is going to be a key topic, obviously. The Wakefield and MMR scandal. Recently, he published a movie and it was called Anti-Vax. So fun fact for you guys. The Francis reports, so how hospitals were neglected, how the overburdened and understaffed NHS has led to deaths in the NHS, essentially. You can do research topics in any of these, by the way, as well, because they're all really debatable hot topics as well. Other NHS background knowledge. I am going to go through all of these. So AI being used in medicine. This is going to be really hot topic as well for you guys, because ChatGPT and all of that. Can AI replace doctors, replace nurses in particular? That's also going to be something that can be asked in your interview. In my Leicester interview, they didn't ask one question per station. They asked multiple. So they can shift between topics within that specific station. So there was this one station that I remember, they had 5 completely different questions. So be aware of that they can ask absolutely anything, and you might just have to give a 2-minute little talk on it. HIV and PrEP advantages and disadvantages. I'm sure you've had those lessons at school. Brexit and the NHS. This is also really topical. Something that really impacts in terms of Brexit and the NHS is that for example, nurses, etc., they might be coming from different countries, and especially the European Union, because there's less visa problems, I guess, and we have a shortage of nurses as a result of that, and doctors also come from the European Union as well. So having Brexit makes it harder for those healthcare workers to come in and work for the NHS, and it's sort of exacerbating that staffing crisis as well. We have a question in the chat. Can I mention talking to overseas doctors whilst on work experience? Definitely in your interviews, but maybe not in your personal statement, because talking to overseas doctors is a really unique experience that you can have, and it compares healthcare systems, and it
Ow.
means, sorry, can someone mute themselves? And it makes sure that you know thoroughly how the NHS compares to NHS doctors and their lifestyles compared to, say, for example, a doctor working in Australia or New Zealand or America, for example, or India or Pakistan. Going on to the next topic, the local council trials. Now, depending on which interviews you go to, so for example, if you go to Birmingham, they obviously might not have asked this, but it's really topical and something to mention maybe in your interviews, is that you essentially have funding that was given to particularly poorer societies within these cities that was help them to educate them and get them off like the obesity crisis, and also like educate them on mental health as well. So you know, if you're aware that BAME people from BAME backgrounds, they tend to have a bit of stigma associated with mental health. So trying to overcome that is one of the reasons why they've given funding to these particular cities. Another thing is the fat tax and the obesity crisis. You can also slot in the sugar tax as well. And these are going to be really topical as well, because these are really crucial in a tackling those further um sort of underfunding issues, because if you have more obesity, then it means that more is spent on obesity. I think they spend around £5 billion on obesity every year. And so if you can nub that at the start, talking to students at primary schools, for example, talking to students at secondary school, maybe not putting McDonald's next to a secondary school, that's all going to help you tackle the obesity crisis. One of the questions maybe that I can think of at the top of my head was how do you think we can improve the obesity crisis? Now, that's such an open-ended question, and you have 2 to 3 minutes to answer that particular question. So how are you going to tackle that? Well, you can talk about the fat tax, the sugar tax. You can talk about maybe the article that they've given you. You can talk about the research that you found, any stats that you have to do with that particular crisis as well. I've got another question in the chat. Can I mention being of an ethnic minority in the NHS in my personal statement, or is that cliche? You can definitely mention it. I would just be aware that a lot of NHS doctors are from a BAME background, so it's good, but it has to have like a sort of substance to it. So like, did you for example, did you find that there was mental health stigma? Did you find that there was less organ donations from BAME people or something like that? Or have you experienced something like that, or racism or something like that? And that can also really help you. And that's worth putting in your personal statement. But being of an ethnic minority by itself, or like being representative of the BMAE population, is not that useful. Would talking about my own personal experiences of the NHS be a good idea in interview? And PS, I was quite young, but I remember a lot. Yes, absolutely. Talk about your own experiences. It means that you can sort of see that you see the NHS from both a doctor's perspective when you were doing your work experience, and also as a patient. And that's going to be really useful in being able to display those empathy skills when people have gone through the same sort of situations or diagnosis as you were able to relate to them. Were you able to help them? Did you recognize how much effort the NHS put into your care, etc., etc.? A&E in crisis. So I don't know if you guys have heard of the long-term NHS plan, but the A&E in crisis is essentially they've tried to make it so that you are treated under emergency care or answered within the 3 hours. Obviously, that's not true, because the average is around 4.5 hours or something like that. Junior doctor contract, obviously this is a very hot topic. Junior doctors are under strikes right now, they're underpaid. There's horrible working conditions at the moment. Obviously don't say horrible, just say stressful, otherwise you're probably gonna get a side eye. Mental health and eating disorders, so for example, anorexia, bulimia, how there's stigma within certain societies and populations. They can definitely ask you about self-harming, by the way. That's definitely a topic that can come up. Depression, what can cause it? So I don't know if you guys are aware, and sorry if this is triggering, but doctors have a 7 times higher likelihood of suicide. So be aware of these statistics and know what you're getting yourself into. Medicinal cannabis. Oh, I've got a question. What are the best resources to find out more about these topics? So previously mentioned Medic Portal. That's going to be really helpful in giving you those free resources, and also get a subscription to Medfully. That should be really helpful as well. In terms of another question. How would you mention these statistics in interviews? Yeah, you would say it in interviews. So, for example, in my Kings, I know this is going to come across as really neaky, but you do need to know a little bit of stats to make you stand out. But essentially, when I was talking about COVID, I think it was, and they were talking about COVID, and I said that a lot of COVID strains came from Spain. I think it was like 3% of COVID strains came from Spain. So we really need to be able to share our resources to other countries so that they can solve their COVID crisis first, so that it doesn't spread to other countries, for example. So you would sort of like really subtly add it in so that they don't really notice. Or like, for example, previously mentioned the obesity crisis. The £5 billion spent on the NHS, you can say how it's already underfunded, and having the obesity crisis already puts a major strain on the underfunding of the NHS. Medicinal cannabis, so knowing the cases of Billy Caldwell or Alfie Dingley, these are really like general topics in a sense. And then cannabis is also a hot topic, but it's not as, say, referenced. I know that there was a talk that was given at my school about cannabis, and I would have mentioned that in interviews, but it didn't really come up, so I didn't really mention it. Organ donation, so opt in and opt out. You can connect this to other situations. So, for example, the BAME and the NHS, and how they have a shortage of organ donations, which means that people who are from BME backgrounds are more likely to die because they don't have an organ donor if they're in that particular situation. Whether if it's beneficial for opt-in and opt-out situations. So, for example, do you really need do you really need the whole population to donate their organs? Is it really ethical to just be taking organs without consent if it's opt-out? Health tourism. So a lot of the money, I don't know if you guys are aware, but a lot of the money of the NHS also especially for individual hospitals, comes from like people from other countries coming into the UK for treatment, because NHS, even though they are underfunded and low staffed and just overall a mess, they also have the best healthcare service possibly in the world. They have the best resources because it's all centralized systems. So being able to reference that you need health tourism in order to fund particular hospitals. So, for example, I think I read about a case about a Saudi Arabian prince being treated at a London hospital. Obviously, for that particular hospital, it would have brought a lot of money in and helped a lot of other patients who are free under the NHS. Aging population. So this is also going to be really crucial. Obviously, I've mentioned that before. antibiotic resistance. So this is also a big problem in the NHS and also abroad as well. Being aware of MRSA. Have you guys covered this in the biology topics that you've done at school? Is going to be really helpful. The Shropshire maternity scandal, similar to how in the Francis reports, there was too much understaffing, too much overburdened people, and that led to essentially deaths in babies. That shouldn't have really happened, and that's really horrible to hear as well. The medical licensing assessment, so you need to be aware that in your 5th year, you are going to be doing an assessment that assesses all 5 years of your medical score and doesn't affect which hospital that you go to at the end, but really affects, for example, how the UK does in comparison to other universities in the world, and also for people coming abroad, they're going to also set the medical licensing assessment so that your scores can be compared to international students as well. And also you'll have a proper ranking in terms of medical schools as well. The benefits of medical licensing assessment means that all doctors are going to be at the same level when they become an FY1 doctor, because at the moment they have each medical student has a different type of medical school licensing exam at the end of their course. In terms of Lucy Letby, obviously that's a topical case. I would be careful in terms of mentioning it in your personal statement. I think the other day someone asked me if they could use the Lucy Letby case in their personal statement. I would say possibly not, because the Lucy Letby case is weird in the sense that it was the nurse who was doing the damage. Like, these are people who you're meant to trust. They are health professionals that you're meant to trust. So maybe the only thing that you can possibly question about it is the fact that, is our training for nurses enough? Is our training for doctors and nurses thorough enough? Are we doing enough checks on them? Are we doing enough mental health checks on them to see if they're fit enough to do this role? We also need to be aware of the cost of living crisis. So this means that many people are suffering from, especially in the winter, from hypothermia issues, from, for example, they can't afford their subscriptions. I know there was a case where like a particular patient could not afford their sort of antiseptic medicine, and so their infection got worse and then eventually led to sepsis, all because they couldn't afford their medicine because of the cost of living crisis. Also be aware of junior doctor strikes, as I've mentioned before. Opioid crisis. Now, this is more of an American thing than anything, but you could possibly mention it if they do ever ask you, or if you're talking about medicine or cannabis, something to rope in here is the opioid crisis. And then funding for the NHS, obviously that's an issue. Underpaid people, does that strain them mentally, physically? If doctors are willing to practically work for free. Training pathways, so in terms of are they the sort of FY1, FY2, going on to becoming a consultant and maybe becoming a surgeon? How are they different training pathways as well? So please be aware of all those sorts of situations. I've left this up. You'll be able to see the recording later, so if you want to take a screenshot, go ahead. Do we have any questions on the topics covered around the NHS? This is not a full total list, by the way, guys. You could go on forever with this list, but these are sort of like the main topics that you might come across in your interviews or in your interview prep, at least. In my interviews, I'd say that a lot of them were basic questions, but definitely KCL were like very up to date in their sort of question making, I guess, and also Leicester as well. Okay, so this is a break and questions part 2. Um, the time is 10:36. I'll answer these questions for another 20 minutes, and then this is a bit of a longer break. So hopefully you guys found that helpful for now. And then we'll move on to BMAT, and Addy will talk a little bit about how he prepped for BMAT, a little bit about how he found certain resources effective, so on. So yeah, hopefully that has helped you guys so far. I'll keep a break. The chat is open for you guys to ask any questions, and I will answer them. So I just had a question saying, how did you overcome interview nerves? Honestly, it was so scary. Even doing this talk to you guys is kind of scary. But also, like, I would say, every time before my interview, I would set it up literally exactly like this, and then I would get a glass of water as well. Doing those mock interviews are going to be really helpful. Um, sort of like keeping it to unfamiliar people. That's why I recommend try not to do the interview prep with your friends if you can. But obviously it's harder to practice with people who are like not even your friends. But try to keep it in your medical society, or do random people, your teachers, for example, if you can. And sort of practicing those mock interviews with sort of random people is really going to help you. Also, make sure you're practicing in front of a mirror. Practice, please, out loud. Don't think, oh, I'm practicing it in my head. No, because it doesn't come out right on the day. So yeah, I would say that on the day in terms of Sheffield, because those were an in-person interview, a lot of the people were gap year students, especially the girls that I was talking to. And then a lot of like literally everyone was taller than me because I'm 5'5" and really short. So I got really nervous on Sheffield's interview day. I had to sort of calm myself in the sense that I deserve to be here just like everyone else. I've got the stats that was needed to get me to this stage. And so you need to be aware that you're really fighting for this position alongside everyone else. And a lot of unis, they advertise, well, um, we've got 800 places. They don't have 800 places. They just want you to like sort of apply there and make sure that you apply to their uni, because then they can get more funding, or they can apply for, I don't know, certain like perks, I guess, for their medical school if they have more applications. That's definitely a mistake I did with Leicester, because a lot of their applicants were gap year students, because Leicester offers this unconditional offer for gap year students. And so they only gave out 500 offers, even though they said on their website 800 offers. So I was like, hey, if I get to the interview stage, then I'm practically securing an offer, which is absolutely not the case. I would say tend to go like if you're a higher UCAT scorer, go for those interview places that have a higher post-interview offer rate. So for example, KCL has a really high post-interview offer rate, or like Aston, where they look at your UCAT a lot. I'll come on to that later, obviously. But essentially, those are the things that you're looking out for. So somebody just asked, they're on widening participation, from what I understand, and they've got secured interview offers for Birmingham and Nottingham. Um, I'd say I'm not quite sure if you're just fighting for WP offers or if you're fighting for interview offers. I think I from what I remember, it's interview, like it's fair competition because the maybe post interview when they count up your score, it might be adjusted. Um However, the interviewers themselves don't know whether or not you're WP or not, widening participation or not. So be careful. I think you, I'm not quite sure because I'm not widening participation myself, but you might have to do some more research on it. Definitely ask medical students who have gone through the same process as you, if you can find them. And I'm going to guess that the scoring would be fair competition, but they would adjust it afterwards is my guess. But I'm not quite sure on that one. Were you given the opportunity to ask questions at each interview? Is it beneficial to prepare questions? Um, I did not get any time to ask questions apart from my King's College interview, because essentially, in the Aston interview, you're really rushed for time. I was basically wrapping my answers, so there was no time to ask any questions. Because it was like one question was 1 minute long, and there were 5 questions that we had to get through in 5 minutes. My Leicester interview was 3 minutes, and then they just sat in silence. It was really awkward. And also they didn't really like. Then some of them are medical professionals, but some of them aren't, and like they're really just ticking off a sheet. So like they don't really. They're not like seeing if there's like a bond with you. They're not marking you on your communication skills per se. They're really marking you on like your content. So they don't really care as much. And then finally, Kings, I did get an opportunity to ask questions. And I just had a little chat with the psychiatrist and how his experience of being at King's College London was. But obviously, you don't need to do that. Honestly, he was like, if you don't have any questions, we can end the interview now. That's the benefit of online interviews is that you can just move on with your life. But if you want, you can get questions prepared beforehand because that's just sort of making sure that in case that situation does come up, then you can definitely ask those questions. So, any advice in terms of role play questions? Well, obviously practice with your friends. Role play questions nowadays is via online. So essentially, you're talking about they might give you a role play situation in which um essentially they talk about like an audio clip and like you have to respond to that. Those are like, and also like there might be a call or something like that. That's the one that I had in my lesser, I think. And then another one was for example, you might actually get role play interviews in the sense that person to person, but I think I only had one of that out of all of them. I think I had one at Aston as well. I had two at Aston, but they were also like, they were, one of them was like between three people, so it was like a group discussion more than like a role play. Um, but definitely like get your acting and drama skills on. It's essentially like a drama moment, and you're trying to be as empathetic and sympathetic as possible, compassion. They're looking for your empathy and communication skills essentially. And I'd say prepare by um, talking. If you have a sibling, it's going to be really easy for you because they're already dramatic as hell. So like practice with them. If you have sort of peers that can help you on the process, if they're also doing medical school interviews, practice with them as well. And there are loads and loads of role play scenarios on the Medic Mind website. So if you know your medical school is going to do role play, then have an idea of how to do role plays and how to approach them as well. In terms of where to go for these role play questions, we had drama teachers do them in our one MMI session, so that can be also really beneficial. Um, and talk to, yeah, essentially use your peers and your friends and your siblings. If you don't have any of those, maybe like look up a YouTube video in which they do role play scenarios. I think there's loads of like OSCE scenarios that you can look at as well on YouTube, that can help you see how the role play should go. So syllogisms in the UCAT, so try and use Venn diagrams if you can. Obviously I have tutoring for that if you need it. But also make sure that you're recognizing those categories, those extreme words. If you can't do it via Venn diagram, if you've tried the arrow method or something like that, someone told me it ages ago that they found it more effective to use the arrow method, then that's perfectly fine as well. Look it up on YouTube for the arrow method, or we can tutor you as well on this particular syllogisms questions. Sometimes they can be confusing, especially when it's like really stupid words, like I don't know, E's and R's like are from two different places or something like that. And then it talks about E's eat lettuces or something like that. It's really annoying because those names don't stick in your mind. But a lot of practice is needed for syllogisms, but also try to draw the Venn diagrams out on a whiteboard first before you move on to doing them timed. And I know initially you might struggle on drawing out Venn diagrams, but once you've sort of like broken it down and like figured out how to do them, it becomes so easy, and then you can like sort of picture them in your mind. So somebody just asked me what were my motivations for going for medicine. So honestly, um, like in terms of the interview answer, it would be like because like two of my friends were in critical condition essentially. One of them got diagnosed with type 1 diabetes, so I had to essentially look after them a lot. I had to go to the hospital with her once. I had to go to the school sort of nurse a lot with her. I missed a lot of lessons when I was sort of like, especially when she was just getting diagnosed in year 8, and I helped her out a lot. I saw what the NHS had done for her as well. So they helped her in terms of nurses came to visit her a lot. So if you're aware of diabetic nurses, there's a lot of sort of people who look after her in terms of her diet, people who look after her, consultants, endocrinologists. Also, because she's quite young and she can't control her insulin as well, she also has a Dex pump. I don't know if you guys know what a Dex pump is, but essentially, it controls your insulin for you. It's essentially a pancreas, but on the outside, and it has a little device and it pumps insulin. And so going through all of those experiences kind of exposed me to like medicine in the first place. For the longest time, I wanted to be an archaeologist, but that sort of event kind of pushed me towards it. And also like having that work experience background and then also volunteering. I really like helping people, hence the free webinar. And essentially, yeah, that's basically the main reason why. And also because I don't like English and I don't want to do law and I don't want to do anything to do with writing. So all of that was sort of ruled out for me. And then I didn't want to do anything like psychology, English, law, literature. So all of that was ruled out. Essentially, sciences was the only thing. I scored really high on my physics. I was debating between physics and maths for A level. And then I came onto the conclusion that maths was better for me. And I was like, I was either going to go for medicine or like the sort of physics sides of things. So I really took a U-turn when everything sort of happened, essentially. So it is 11 o'clock. Addie is going to take over the BMAT part of this session.
Yeah, hi, can you hear me?
Yeah.
Okay, yeah, so my name is Adi, and I'm also joining King's in a few weeks for medicine. And today I'm just going to give you a bit of an intro into the BMAT, and also I'm here to just answer any of your questions about either the BMAT or in general about my application. So last year I applied to Birmingham, Bristol, King's, and Cambridge, and I got interviews from all four of them and offers from Birmingham and King's. I did the BMAT last year, so just for Cambridge, and I managed to get 6.5 in section 1, 6 in section 2, and 3.5A in section 3. Um, the BMAT is also used by Brighton, Sussex, Imperial, Lancaster, UCL, and Oxford. This year, your BMAT will be on the 18th of October, and you'll be getting your results on a bit later on the 24th of November. And this is really one key difference between the UCAT and BMAT, because you don't find out your score before sending off uh, your applications to UCAS. And yeah, the BMAT is being discontinued next year, so you'll be the last batch that actually gets to sit the exam. But to be honest, I think being able to sit it is a good thing because it's a really nice backup if for example you messed up your UCAT and you're not too sure if you're going to get it, you're not too sure about getting all of your interviews from UCAT universities. So a BMAT could be a good backup choice um, in case you aren't sure about that. But it is also a bit more tricky to apply with the BMAT because you don't know your score until after you've sent off your applications. So you could have done bad on the BMAT And unlike with the UCAT, you can't apply strategically with that. So that's for me, that's why I chose only to apply to Cambridge as a BMAT uni, because I was very sure that with my UCAT score, I'd be able to get the three other interviews that I'd applied for. And even if the BMAT was really bad and I messed up and I didn't get a Cambridge interview, I'd still have three other chances to get into medicine. Um, but yeah, as I said, the BMAT is a good option if you didn't do the UCAT, if your UCAT didn't go too well as well. And you can use it as a second chance to get an interview. So the BMAT has three sections. Section one is thinking skills, which is essentially critical thinking, which is sort of like verbal reasoning from the UCAT, and also problem solving, which is numerical reasoning. And there's 32 questions to answer in 1 hour, and 16 of these will be critical thinking, and the other 16 will be problem solving. And these are all multiple choice with five options for each question. And with this, you get a score from 1 to 9. And it's the same for section two, which is your scientific knowledge and application section, which has maths, chemistry, biology, and physics. And that's up to a GCSE level of knowledge. But even though people say that, it's still pretty challenging and it's not always the simple GCSE things that you were used to seeing. And this is a bit more time pressured with 27 questions in 30 minutes. And this is multiple choice as well. But the number of options vary from 5 to 8 options. And there'll be 7 questions each for chemistry, biology, and physics, and 6 questions for maths. And again, this is scored from 1 to 9. And then finally, section three is your essay. And for the essay, you're given three different questions to choose from. One is a bit more general, one is scientific, and one is medical. And you're given 30 minutes to complete this, and you're limited to one side of A4. And you're marked from on your quality of content on a scale of 1 to 5, and also quality of English from X to A. The score for your quality of content is marked by two separate markers, and the score they give is taken, and an average of it is used to give you your score. So, for example, if one says that your essay is a 3, but the other thinks it's a 4, your score would be a 3.5. And if there's a wider discrepancy between the two markers, then a more senior marker will decide on what your essay should be given. So, in terms of preparing for the BMAT, 6 weeks, like for the UCAT, is generally good. But for me, I did about 5-ish because I was a bit lazy right after doing my UCAT. And also because I had school during the time, it can get in the way a bit. But I tried to keep the focus on the BMAT and ignored school for a bit because to me at the time, it seemed more important to focus on the BMAT applications rather than A levels because I was pretty sure that I could get back on track with A level stuff after I'd finished all of the BMAT preparation. Um, so for section one, problem solving questions are more mathematical. So you need to get used to working on paper because one big thing about the BMAT is that you don't get a calculator. And so you really need to get good with your mental math skills and also being able to work on paper. And problem solving is for me it was the more challenging type of question, and it requires a bit more thinking. And the other type of question, which is critical thinking, it asks you to identify conclusions, assumptions, and flaws in arguments presented in short passages of text, as well as identify which options might strengthen or weaken an argument. And I found this type of question much easier for me to solve, as when you do questions, you really start developing an understanding for what makes arguments stronger and weaker, and what you get to see this much more easily. But for me, within this, the hardest subtype of question was assumptions, where they'd ask you to find out, they'd give you an argument, and it would seem very logical, but there'd be an assumption within the argument, and you'd have to try and identify what it is. And again, with practice, you'd get better with this, but it's still something that I found quite hard. But the rest of critical thinking is questions like finding the conclusion of an argument, which were much easier for me. So I prioritized these in the exam and came back to the difficult problem solving ones later. And some parts of this section you'll find are quite similar to the UCAT, especially similar to verbal reasoning, except because you have 32 questions in 1 hour, you actually have much more time to read the paragraph. And also your UCAT prep will have helped you in some way to prepare for this. And although it does seem less time pressured, it's not like you still have ages to spend on each question. It is still more challenging than UCAT questions, so you will have to think more, hence why they give you more time. But I still prefer this to the UCAT because you have time to sort of read the paragraph in peace without having to skim read it and things. Um, so the best method for this section was really just to practice the questions as much as you can and focus on your weak areas. So for me, this involved practicing a lot of the assumptions questions. And you can find all of the past papers on the BMAT website from Cambridge themselves. And for me, this I think was the best resource. When I was preparing for my BMAT, I also used BMAT Ninja, which is part of 6med, and they were a paid subscription, and they were also good. But I'll come on to why I think it would be better to just use the BMAT resources from Cambridge themselves. But for preparing, the best thing to do is really just questions and focusing on what you're finding weak. Um, BMAT Ninja also had some really good video tips on this section. For example, there's just one type of question that comes up every year in problem solving, which is about a dice, and they basically the video or tip basically told you to take a rubber into the exam and draw the sides of the dice onto the rubber with a pencil, and then you can rotate it in any way you want to help you answer with spatial reasoning questions. And this is really helpful if you aren't too good at this. And this actually came up in my own BMAT exam last year, but with the stress of the exam, I kind of panicked and fumbled on that question. But it was still a good tip, which I know some of my other friends used. But still, the best way to get better is to practice over and over. And then for section two, your main worry for this is probably physics. I'm guessing most of you haven't taken physics for A level, but honestly, physics questions are a blessing in this section. I didn't do A level physics either. I did maths, chemistry, and biology. So I had to renew my knowledge in GCSE physics again. And the topics you need to know are electricity, magnetism, mechanics, thermal physics, matter, waves, and radioactivity. And there are more details about what you need to know exactly on their specification, which I'll come on to again in a minute. But honestly, there's no need to worry about physics. Most of the questions in physics were actually really easy, especially once you've learned all the formulas that you need. And honestly, a lot of the maths and chemistry questions were much harder, at least in my experience. And I was taking these for A level. Um, and the main reason for that is because you don't have a calculator. So it's quite hard to do a lot of the calculations in your head and in time because section two is a lot more time pressured. You have just over a minute per question. So it takes a lot more time it's a lot more time pressure to get through these. And so one key point to really remember in this section is that all questions are worth the same mark. So there'll be some that are really easy and will literally just take you a few seconds to get the right answer. But there are others that are like super complex and it will just take you so much time to do the maths or the working out in order to work it out that it's just better to leave it and come back to it if you have time. And I'll just give you a quick overview of what other topics you need to go over. So for biology, there's cells, movement across membranes, cell division and sex determination, inheritance, DNA, gene technologies, variation, enzymes, animal physiology, ecosystems. So all of these are things you probably have done in A level, so there won't be that much to go over. And then chemistry has a lot of topics, but you shouldn't really like that scare you too much because a lot of these are pretty simple. So there's atomic structure, periodic table, chemical reactions and equations, quantitative chemistry, redox reactions, bonding and structure, group chemistry, separation techniques, acids, bases, and salts, rates of reactions, energetics, electrolysis, organic chemistry, metals, kinetic and particle theory, chemical tests, air and water. And again, I'm sure most of you have done most of these again at A level, but there are some that are a bit more random, like air and water, that you might need to go over again. And then finally for maths, you need to know units, numbers, ratios and proportions, algebra, geometry, statistics, and probability. And that doesn't sound like much, but honestly, some of the maths questions are really tricky and take a lot of time to get through. But the way I approached the content was to make a list of the topics from the spec. So the spec you can find on the Cambridge assessments website. If you just search for BMAT on Cambridge, it will come up, and it's got a general spec and also a very detailed one that tells you everything, every spec point that you need to know. And so I made a list of all the generic topics from the spec, and I rated and ranked them based on my confidence in those topics. And then, so in my first week of really revising for the BMAT, I'd go through the lowest confidence ones um, in the section 2 guide. So this is another resource you can find on the Cambridge website, and this is really like a textbook, an a textbook that they give you on the website, and it has all of the content that you need to know for the BMAT, and is written by the Cambridge themselves, so you know that it has everything that you need. So I'd go through everything on that online guide, and then if I was really struggling on something, I'd make some flashcards to help me learn the content. And this is something I really used for physics, especially with the formulas, because there were so many formulas, and knowing these formulas just allows you to answer so many more questions, and it makes it way easier. And most of the physics questions are really just formulas. Um, Also, some other things I use were my old GCSE revision guides that I'd left over for topics um, that I found hard, as well as YouTube videos that I used to help me get it in GCSEs. And this is really useful for random topics like magnetism in physics, which even from GCSE I never really understood that well. Then after I got good with the content, um, what I did was I just start questions again, and I'd grind those and focus on the weak topics that came up from questions. And then in the first week of my BMAT prep, um, I was doing questions from section 1 while learning content from the spec for section 2. And then from week 2 onwards, I started doing questions for both sections while also learning a bit more content. Um, and then for your question about your GCSEs, um, I think it really depends where which university you're applying to. So I know for Cambridge, um, they do look at GCSEs, but they have a more holistic approach. So they'll look at all aspects of your application. So I think for Cambridge, it would be good um, for getting an interview, especially if your BMAT and personal statement are good. For Oxford, I know they have a pretty high weighting on the GCSEs, which I'll come on to a bit later. But I think for Cambridge, those GCSEs would be fine. But that also depends on your other stats, such as your BMAT and your personal statement. Yeah. So, as I was saying, having a no calculator makes it the BMAT much harder. So it's really essential to practice your mental maths and working on paper, as well as rounding and making good guesstimates. And aside from this, past papers are again the best way to expose you to all the content. But I did also use BMAT Ninja, again mainly for the video explanations that I had. that they had, which were really with some of them which were really good, I found. And some of these are actually free on YouTube. You can find them on, I think it was either their channel or Ali Abdal's channel. They both have good BMAT explanations. And then finally for section three, which is the essay, this section I kind of neglected a bit because I was more worried about section one and two. So all I really did for these were I planned out a few essays, a few past paper essays, and then I wrote out a couple as well. And then I asked one of my teachers to mark it to their mark scheme, which you can also find on their website. And I wasn't really that worried about it because I knew that most people get a 3A, and most universities don't care about this essay too much, and getting a 3A is fine. And I'll show you some statistics later, but 3A is normally very just what most people get, and that's fine for most universities. Some unis will care a bit more about the essay. And I know that there's some universities or colleges within Oxbridge that actually use your essay in the interview. So they'll actually like pull out your essay and ask you questions about it. Um, but I knew that my college that I had applied to in Cambridge didn't do that. So I wasn't that worried about the essay for this reason. But if you are planning on applying to somewhere that does use the essay in the interview, I know a lot of people after the BMAT wrote down what they wrote about in the essay, so that if it came up in the interview, they'd have points to talk about. Because you don't get to see your essay again before an interview. And then just to give you an idea of what a good score might be. So for last year's BMAT, about 20% of students scored between a 5 and 6 in section one, and 10% scored over section six. Sorry, over six. And you saw the same trend for section two. Section three is the one that differs the most, and over 40% of people got a three for quality of content, and 20% got above a three for quality of English. And then there's 75% of people who get a grade A for the quality of language. And so this is why I really wasn't worried, because most people get a 3A, and that's really all you need for an essay. So I left that more, but it is still a good idea to plan out some essays and write out a few essays in full, just to see how long it takes you to write within, and whether you can write for a full page of A4 in that 30-minute slot that you get. And then also just to get these marked by a teacher at your school if possible. You can go to your old English teachers maybe and ask them if they'd mark it for you. I was very lucky because I had a teacher in my school who went to Oxford, and I knew he'd done things like this before for his own applications and also within uni. So I'd asked him to mark it for me. So if you have something like that as well, that'd also be really good. Um, but so obviously a good score really depends on where you're applying. So I applied to Pembroke College in Cambridge, and my BMAT was quite good. And this did manage to get me an interview, but I didn't get an offer. And in my feedback, they told me how my interview was strong. But even though my BMAT scores were above average in all sections compared to the average Cambridge applicant, it was below average in section one and two to offer holders at that college, and my section three score was the average for their college. But again, even within Cambridge, the BMAT requirements vary between the colleges. And I know people in my year in school who looked at things like freedom of information requests to see what sorts of BMAT scores people get into each college with. And they applied a bit more tactically and looked at which colleges seem to take lower BMAT scores. But from my experience, if you think you're really strong at interviews and you can make up for a lower BMAT score, then Cambridge would be a good place to apply, because a lot of my friends who got lower BMAT scores, um, some of which were even below the average, managed to get an interview. As for other universities, I don't really have first-hand experience with applying to them, but I have found some information online about their requirements. So I know that Brighton and Sussex had a minimum cutoff of at least a 3 in section 1 and a 2 sorry, a 3 in section 1 and 2 and a 2.5 C in section 3. And if you meet this, you'll be ranked by your BMAT score and called to interview. For Imperial, they have a minimum which varies, but it's generally between 4 to 5 in section 1 and 2 and a 2.53 in section 3. And then UCL are less clear about their requirements, but they take your personal statement, exam results, and predicted grades into consideration. So it might be a bit less of a risky option if these other areas of your application are stronger and can make up for a weaker BMAT score if it doesn't go so well on the day. And then Oxford doesn't outline exactly what they need, but they weigh both the BMAT and your GCSEs equally to select for your interview. But they are a bit more harsh on selecting candidates for interview. Um, and then finally, Lancaster University ranks your applicants based on the sum score of their 3 sections. So the quality of English in your essay is not really looked at. Um, but with all of these unis, it's really important to look at all their requirements before applying to maximize your chances of getting an interview. So just as a summary, the best resources initially is the Cambridge specification, just to see what you know and don't know. And then the best thing definitely is the Cambridge Section 2 guide for learning content. This is found on their website. And then after that is for everything is just past papers. Just do as many questions as you can. BMAT Ninja is also good, but I found that past papers were the best resource, and BMAT Ninja's questions were actually just questions from these papers and other similar Cambridge assessments that they have. So as well as a few of their own that they'd made. Um, so doing these papers after the doing papers after doing the BMAT Ninja questions. Uh, sorry, yeah, I'm in King's now. I'm going into my first year at King's. Um, so yeah, uh, doing the papers after doing BMAT Ninja questions wasn't as effective because I'd seen some of the questions already. And another small problem that me and some friends had found with BMAT Ninja was that for some of their questions, the answer options would only go from A to E, but in the actual exam, you can have many more choices like from A to H. And the main difference this makes is that it's much harder and time consuming to find the right answer by elimination because when there are so many more options. So if I had to do the BMAT again, I'd mainly focus on resources given by Cambridge themselves, especially the Section 2 guide, and most importantly, the past papers, which go all the way back to 2003. So you're not really going to run out of questions to use. But that's all I have to say for the BMAT. But I'm happy to answer any questions you have about BMAT or anything else. Okay,
Um,
Birmingham interview. Okay.
oh yeah,
Um,
so thank you. I'm just gonna read out some of the questions. It says, but what was the Birmingham interview like? Do you want to answer that one first?
yeah, sure. So my Birmingham interview is in person, and it was a MMI interview, I think with 6 or 7 stations. I can't exactly remember now. And I actually liked this interview as I think it was one of my favorite interviews I did because the interviewers were really friendly, except one station where I felt like the lady wasn't really paying that much attention to me, but that's something you sort of expect going into interviews, you because of like stories you've heard and stuff. But other than that, they were super friendly and they made you feel like really comfortable with them. And also just the question types in general, they felt a bit more like standard questions, including there's one station that was just a calculation, and that for me was really good because it wasn't really hard maths. It was just a lot of reading, and that's just to me it seemed like free interview marks. And then also there was a role play station which was quite good because again the interior was really friendly. Um, and then there's also some other stations with like data interpretation which again is not too hard. and you find that most of the time they'll help you or guide you through it. So yeah.
Do you want to talk about like the other interviews you did as well?
Yeah, sure. So my Cambridge interview was the most different to the others, as I'm sure you know. Um, in terms of like the normal, like generic questions, they only asked me one of those at the start, and then after that, it was all more scientific stuff. So my interview was a bit different to other people because my college only does one interview, whereas the other colleges that my friends had applied to, they did two interviews. So my interview split into two halves. So one person would ask me questions in the first half, and the other person would ask me in the other half. So in the first half, um, the interviewer asked me about my personal statement a bit, and then he started asking me about more topics around more like hot topic things and things in the news. Um, and then it was really science focused, and it was more about trying to explain your thought process and not worrying too much about what you're actually whether you're actually getting the answers correct, just trying to explain how you're thinking. And that's like the main key thing for Cambridge interviews whenever you see any of them. Um, and anytime you stray from what they want you to say, they'll sort of guide you back to what they want, and they'll help you through the answers. Um, and then anytime you're stuck, you can really just ask them for help, and it's not like a bad thing asking for help. They want you to do that because they're trying to see if you'll fit into their style of teaching with the tutorials and supervisions. So I actually really like my Cambridge interview for that. Um, and it was about, I think, 35-minute interview. So not that long compared to like an MMI. Um, yeah. And then my other interviews, so I had my King's interview, which obviously she talked about. Um, that was very similar to mine was very similar to hers, and um, in my King's interview, I think it was more a bit more discussion, like um, even though they had a very it was it felt more conversational, even though it was in a MMI sort of format, because they would have strict times to ask me questions, but they gave me a lot of time to talk, which is one thing that was very surprising because I thought it would be like they'd ask me a question and then I'd answer and they'd give me follow-ups. But a lot of the time I just kept on talking, and sometimes I think I'd go into a lot of waffle. So that's when like knowing a lot of random things and, for example, statistics that you can go on about is really useful. Um, and then for uh, my Bristol interview was also an online MMI. This was they gave me a video to watch before, sorry, not a video. They told me to read the GMC guidelines for medical students beforehand because they'd asked me questions about this. And um, one of the stations was about that, and then the other stations were about more about my skills, things I'd experienced in work experience, um, and just in general about my volunteering and things like that. And it was a bit more straightforward, but I guess it didn't go too well because I didn't get an offer.
Okay, so we're gonna finish off BMAT now, and we're gonna go on to tactically applying. Thanks, Adi.
Yeah, no
Um,
worries. Thank you.
So, tactically applying. So, there are many aspects that you need to consider when tactically applying. Now, you guys have literally sat through 2.5 hours now, and I'm gonna make this really short as possible, and then you can answer any questions that you might like. I can answer any questions that you might have. I think Addie's gonna stay on. If he can't, that's okay as well. And then um we're just going to talk about how your GCSEs, A levels, all of that comes into play when you're tactically applying to a particular university. Tactically applying is so important, guys. Don't underestimate it. A lot of companies offer tactically applying like sessions, for example, which you don't need to sign up for. A lot of people do it for free as well. We do it for free as well. So just message us on MedStar with like your stats, and we can help offer you like guidance on where to apply, because really you shouldn't be paying money for that. There are many aspects you need to consider when tactically applying, and you need to apply to your strengths. If you've got all 8s and 9s at GCSE, where are you going to apply? You're going to apply to sort of those unis that look at GCSEs more. So, for example, King's looks at GCSEs quite a lot. So do Aston, so do a lot of other unis. However, Sheffield barely looks at your GCSEs. Bristol, I think, don't look at your GCSEs either. So just be aware of that and apply to your strengths. The requirements vary depending on whether you qualify as contextual or non-contextual or widening participation. Somebody on my TikTok said, "Oh, isn't that rude to be calling someone non-contextual?" But honestly, like, I just feel like it's just a part of the application process. It isn't meant to cause offense. It's just meant to say, "Hey, look, you've got a bit of an advantage over the others if you have a contextual circumstance that is rightfully given to you, and you can apply accordingly and apply to your strengths of having that contextual scenario." GCSEs are typically strong, so a lot of med applicants have strong GCSEs. This is not to say that if you don't have strong GCSEs, don't apply to med school or whatever, but just apply tactically. So there are schools that don't look at GCSEs as much. So, for example, Imperial, Cambridge, Keele, Sunderland, Exeter, and Plymouth. As far as I think Adi said that Cambridge, do you look at your application a bit more holistically? So be a bit careful, do your own research on the thing. I think I posted a TikTok on like the sort of average UCATs and BMATs that unis look for, and also your A levels predicted scores. I know you've worked so hard for like the whole of year 12 for these predicted A level requirements, but as long as you meet the requirements of the uni, they don't even consider it past that stage, apart from Exeter, which considers it for like if you are going for interview, then they score your A level predicted grades and your UCAT, and they also don't look at GCSEs. In terms of whether you got a high, medium, low UCAT, typically with a high UCAT you can apply anywhere. But honestly, guys, because my Sheffield offer was like through a wait list essentially, and I would have only got it after my King's offer, and it would have been a long wait. I would say that apply to a uni where like you're going to be guaranteed an offer essentially. So if you have a high UCAT like 2,800 plus, then note down like Anglia Ruskin or UEA or Aston. Like just put one of them down. I know like you're like, oh, it's such a low UCAT uni or whatever, like whatever stigma you might have against those unis, which they're absolutely great unis. You just need to study medicine at one of these unis, right? I know people who have got like 3,000 and got rejected at like 3 of their unis. Like that's so scary position to be in, or like they've scored so highly and then got rejected by all 4. So I would say Aston, UEA, or ARU, because in these cases you're sort of securing that offer because they look at the UCAT post interview. If you have a high UCAT, another thing to look at is your post interview rates. So, for example, Leicester has, even though they advertise it on their website that they've got 800 interviews, 1,000 interviews and 800 offers, they're very much false, and you have to look at past sort of statistics looking at like 2023 entry requirements, etc. Also, Aston has their requirements on there, so be careful to which ones you apply to, and be aware that they can vary from year to year, and also be aware that you need to be looking out for the ones that have the greatest offer rate after your interview as well. This is particularly if you have a high UCAT. So we've got a question in the chat. Where can we find 2023 statistics? So normally it should be on the med school website. I know it takes a bit of time for it to upload. I think that's why, from what I remember last year, that's why I applied later. But I'm not quite sure. So you would typically look on the website. I remember Leicester has their like 2023 statistics, and then Aston also has it in their FAQ section, I think. You can also look on, like Addy said, what do they know? FOIs, Freedom of Information Acts. You really have to do your research. That is part of tactically applying. Also, apply if you've got a lower UCAT, so for example around 2,700, 2,600, all the way down to 2,400, you can still get uni interviews even if you have 2,400. This is like crucial because a lot of people think, oh no, I failed my UCAT, now I can't apply anywhere. No, because you can apply tactically and apply to those unis that don't look at your UCATs as much. So universities such as Sunderland and Kiel, they look at the R&R form more than anything else. In fact, they only use the UCAT for borderline situations, and so using them to, and then perhaps getting your R&R form checked by various individuals, teachers, biology teachers, and your perhaps GPs on your placement, etc., is going to be really helpful in guaranteeing an interview over there. I would also say lower UCAT unis like St. George's or Aston, they're also really good choices to put down if you have a lower UCAT, because not only do they generally have lower UCAT applicants, but they also have a less competitive sort of field. Obviously you're still competing for those places and you still have to get the requirements that they ask for. Also consider the BMAT. So for example, I know Addy's mentioned this, but Brighton and Sussex Medical School and Imperial, UCL, Cambridge, they all use the BMAT. Obviously this is the last year it's running, so if you take a gap year after this, obviously it's going to change. I think Imperial's using the UCAT from 2025 entry. So be aware of all these changes. Also, when you're doing the BMAT, obviously revise like he said, but also apply tactically in terms of that as well. So for example, Brighton and Sussex Medical School actually has a high UCAT cutoff. I mean BMAT cutoff. I know this is surprising, and I think it was on the student room. Obviously, don't get dragged down a hole on the student room, but on it says that BSMS has a higher BMAT cutoff than UCL. So just be aware of all these sort of niche things that you sort of need to know when you're tactically applying. Obviously message us on with all your statistics on MedStart. So, and then say your like preferred unis. So be like, okay, here are my GCSEs, my A levels and my UCAT, and then you can ask me, should I apply to Leicester, Aston, Kiel, Sunderland, so forth, and I can advise you. Me and Addy will advise you on where to apply. If we think a uni is a bit risky, we will outright tell you that. So somebody messaged me the other day saying how to tactically apply, and he asked if he was able to apply to Sheffield with a 2860 UCAT score. He was non-contextual. Now, I don't know if you guys know this, but Sheffield's UCAT cutoff went up to 2840 last year. So be aware, for non-contextuals, by the way. So just be aware that UCAT cut-offs can really rise really fast. And so having those safe unis that perhaps look at a lower UCAT is really important to have as well. If there are any questions, put them in the chat. I'm just going to talk about I'm gonna end on this note for now, but I'm just gonna talk about like my application process and just sort of timeline, I guess, in terms of applying to medicine. So September, so you're here in September, you've done this webinar. What are you going to do next? Well, either you're going to do the BMAT prep. Obviously don't start straight away. We've got a question. What do you know about Leeds because they've just introduced the UCAT? Okay, so Leeds is special because Leeds have just introduced the UCAT and we're not quite sure how they'll react. Now, I would say that when a uni starts off with a UCAT, normally when a uni starts off, like Aston, for example, or Anglia Ruskin, when they started, they had lower UCAT requirements. But I don't know if this is going to be the case with Leeds because Leeds is already well established. I'm going to guess that it's going to be around the average mark, that it's going to be an average but less, so around 2,700. But that is completely a guess, by the way, guys. It could be 3,000, who knows? I really doubt it's going to be around 3,000, but it would be around 2,700. I would say 2,600 to 2,800 just to be safe, but around there, I would say. Obviously, try to apply to unis that you know the UCAT cut off quite well. But if you don't have that opportunity and you want to take that risk of going to Leeds, because sometimes like the proximity to your house or something like that can really affect the places that you apply to. So yeah, so the timeline right now, you're going to do your BMAT or you're going to start interview prepping. If you're going to start interview prepping, I really recommend going to as many free webinars as possible. They always always advertise them on Eventbrite, by the way, guys. So keep checking on Eventbrite for free events. Then also go onto that website, the Medic Portal website, and then also talk about like going onto the BMAT prep is essentially what Adi said, do past papers, go on to BMAT Ninja and use his advice, because honestly it's golden advice that you guys might not even come across again, because a lot of these companies, they have established doctors representing them rather than medical students. So, and especially because we're first year medical students, we've just come out of the process, so we literally remember the trauma. My UCAT is on 20th of September. Should I interview prep after or balance it with UCAT prep? Your UCAT's going to be crucial, so obviously do your UCAT first before your interview prep. Obviously, if there's a webinar, maybe attend it, but don't do any heavy core or balance your UCAT prep with your interview prep right now. Just do UCAT. And then, so you finished that, you've done your BMAT now, and you've sort of got okay in your interview prep, and it's around about November, maybe, end of October, start of November, you're starting to get those interview offers. Now, these things come dripping, so they're very random drips of offers, and then also, I would say that the first one that came was Aston, and the second one that came was King's, then Leicester, and then Sheffield was first because Sheffield has those set dates and times, and then it was Aston, King's, and Leicester. So just be aware of that in terms of like the time schedule that you have. I also had mocks in December, so I had to do my mocks in the middle of my interview prep, which was exhausting. If you can take days off school just to like if you want to like take a break because it can be really, really stressful, then just say that you're sick maybe, or like if you're, because you don't want your mental health compromised, and it's going to be really crucial in like just resetting you. So take a break for your mental health sometimes is a really good idea. And also when you start January, you might also have another interview. These are about 1 or 2 interviews after January. One of my friends, she got 2,800 and not 2,800, 2,900, and she had her interview in March for King's. So it can really, really vary in terms of when you have these interviews. They can vary from November all the way to March. Some even had some in April. And imagine going like in that period of time, you're not prepped enough. You sort of have to build up your prep. And if you can get them out of the way as much as possible, it's going to be really crucial as well. I know that my friend who had her interview in March said it felt like she was interview prepping forever, but sort of keep it like back burning, I guess, so that because you have to concentrate on your A levels as well. And guys, when I say year 13 is a step up from year 12, A levels, it's not a joke. And so keep that on the back burner whilst you're revising as well. But if you have like say mocks during that time, it's not going to be important as your interview prep. Also, I would say when you come to exam period during that May-June time, in terms of like booking accommodation, you'll have DBS checks, occupational health checks. There's a lot of things going on after you've got your offer that you need to complete whilst you're doing your exams. I know this sounds horrible, but like it's kind of hard to balance, and so try to get them out of the way as much as possible. Like if you have a task to do, you're going to have to be on top of it throughout the year. Year 13 is quite a busy year. It can be stressful, but you guys will get through it. I know you guys also should form like a MedSoc or whatever in your school. Really depend on them for like support, because they're the only ones who know what you're going through, I guess. Hi Neha, you have mentioned about your friend who went to engineering when we were talking about UCAS fifth choice for medical application. Did this friend opted? Yes, exactly. So he she put 4 choices for medicine, and then the 5th choice was engineering, and another friend did economics as his 5th. Do you have any more questions that I can answer? Perfect. Okay, cool. What were my GCSEs? I got 7 9s and 3 8s flex. But I honestly think that you can still apply to King's even if you don't have perfect GCSEs or 10 A stars. Because I know people who have got like who perhaps made it up in their UCAT or their band, for example. So if you say you got like a 6 or a 7 in one of your subjects, you can easily make that up with a higher UCAT, for example. What other unis you know that consider UCAT post-interview? So mentioned above was University of East Anglia, Anglia Ruskin University. As far as I know, they might have changed it, by the way, so be aware. University of East Anglia considers 50% of your post-interview score is your UCAT. Then in terms of Aston, 75% of your post-interview score is your UCAT. So those are going to be really crucial if you've got a high UCAT score, or even if you've got a low UCAT score. Whether this engineering friend was asked for a separate PS, I know some people who have written a different PS, but I also know other people who have not written a different PS. So I know one of my friends who applied for like a marine biology course wrote a different PS for her marine biology course, but I don't think the engineering friend even wrote a different PS. How do you improve your UCAT score? So drastically improve your UCAT score. It is a long process. You do have like increments. And I feel like there's this thing where you go up from like 2,300, 2,400, and then you get stuck at like 2,700 for a bit, and then you break through and then you start getting those higher scores. So I would say like keep going with like a mock a day, reflecting, or if you're still stuck on those sort of things, maybe it's best to go back to the drawing board and see like if you're answering the questions correctly, if you're using those tactics for each specific question type. If you're struggling in a specific question type, then look at the tactics to answer those questions. Any YouTube recommendations for UCAT? Well, Emil Eddy is definitely the one to go for. I literally don't know anybody else who does UCAT better than him. What time does this finish? Well, it's supposed to finish at 12, but I can stay on a bit longer if you guys have more questions. UCAS, fifth choice for engineering subjects, UCL Imperial, yep. If you're going for those UCL Imperial choices for your engineering choices, then I would highly recommend doing a different personal statement if you're going for like really big unis. The college my friend got admitted to was, I think it was Birmingham engineering. Not quite sure, can't remember too much. But if you're going for like big unis like UCL and Imperial for engineering as your fifth choice, then definitely write a different personal statement. Is 18 days enough for this break though? I'm guessing it's your UCAT, like the stuck at 2,700 thing. I think give it another week. If it still hasn't broken through yet, then maybe obviously 2,700, by the way, guys, you can still apply to a lot of unis. Just be aware of that. If you're still stuck on 2,700 after a week more, or like a week and a half more, then maybe push your UCAT, but I don't know when the last UCAT date is. How can I improve timed questions for the UCAT? As when I'm not doing it under time, I get most of the answers right, but when under time, I don't get to finish all the questions or get most wrong. Okay, so if you're struggling in timed questions, that's a separate issue to say the content. If you're struggling with timed questions, for AR, look at Emil Eddy. He spends 1 minute recognizing the pattern. Then if he doesn't recognize it, flags the whole set and moves on. If not, otherwise he goes through each individual question and within like 2 seconds for that particular set before moving on to the next set. And essentially you're doing like 50 questions, but there are like 10 sets, so you're spending like 1 minute per set. The other sections, for example, DM is all about practice and the order in which you do the questions in. For that, either book a tutoring sessions if you're struggling with DM. I'd highly recommend that. And then also if you're watching Emil Eddy do them, he has like a particular order. So for example, easier Venn diagrams might come first, and then he leaves syllogisms till last. So note down the way that he does the questions in order. Like you do not do them in the order that they give you it in. QR skips those big pie charts and those like 5 different table questions. And then for VR, long passages, history passages that can really confuse you, and those questions that ask you to infer something are also really difficult questions. So skip, flag, move on is really going to be the key to that particular question. Any questions about interviews, BMAT, tactically applying. Will a 6 in English language drag my application down if I got 9s in everything else? No, absolutely not. You just have to apply tactically because I know Leicester score English language really hard, so maybe don't apply to Leicester. I also know Birmingham scores English language really hard as well, so don't apply to Birmingham. But if you say go for like, you could perhaps go for King's, because King's says as long as you've got 8 plus 9s. So if you've got 8 or more 9s, then you have the same score as someone who's got 10 9s, for example. So it definitely doesn't drag your application down. You just have to think about it a little bit more. Also, do you recommend applying to do the UCAT earlier or later? I'm going into year 12 this year. Okay, so in terms of UCAT prep, so I'm so glad that you're really on top of this. If you can, if you're planning to do the BMAT, definitely do the UCAT earlier, because that's going to allow you to spend more time on the BMAT, especially because BMAT is more of an academic orientated test. I know Adi told you guys this, but you can spend a lot of time on the BMAT, and the longer you spend, essentially you're learning more, so you would get a higher score. So earlier if you're doing the BMAT, a little later I did mine on August 31st because I was planning to do the BMAT, but then I changed my mind because I was too stuffed for time. I didn't clarify properly before because I am at 2,500 and peaked 2,700 once. Stay consistent and make gains in the 18 days I have left. Okay, so really you need to be, I think if you peaked at 2,700, keep going and see if you stay at 2,700. It will go up and down. Like, there is no doubt that your scores will always go up and down. Mine ranged from 2,700, like mine ranged from 2,700 all the way up to 3,100, and that's to get a 3,100 score, and you don't need that for med school. Like, you just need like 2,000, like 900 is extraordinary. So I would say that if you I would say, yeah, so keep going, and if you're getting around the 2,700 mark, at like, I mean like 2,600 and then 2,750, like that's going to be really safe, in the sense that if you get to that score, then wait for that week to be over, and then I would go on to sort of aiming for those higher scores. So in terms of 18 days, you can definitely make gains. No doubt you can definitely improve within 18 days. But I would say if you're aiming for 2,700, then definitely you can get that within 18 days if you grind really hard. And then if you're trying to aim for like 2,800, 2,900, I think I would push it back by a week maybe, but this is provided that you're doing effective revision. Okay, so any more questions? Okay, so here we've provided all the services that we give. If you're interested in them, this will be uploaded onto YouTube for those who are watching the recording as well, because I know loads of you have requested that. I'm going to end it here. Hopefully that's been helpful. If you have any questions, always DM me. I know I can be really late in messaging back, but I'm trying my best. And hopefully that's been helpful. Okay, no problem. See you guys whenever, even if you decide to book a tutoring lesson or so forth, or even ask for the personal statement ebook. Bye.